U.S. healthcare domain. Overview of America's healthcare system and services. Understanding the U.S. healthcare domain. Introduction to the U.S. healthcare system. Hybrid public and private structure. The U.S. healthcare system blends public and private organizations delivering and financing medical services. Decentralized governance. Healthcare governance is split across federal, state, and local levels, creating a complex regulatory environment. Healthcare financing methods. Financing depends on employer-sponsored insurance, private plans, and government programs like Medicare and Medicaid. System challenges and innovations. The system faces challenges like unequal access and high costs but excels in medical technology and research. Key characteristics of the U.S. healthcare model. Employer-based insurance. The U.S. healthcare system is largely employer-based, stemming from post-World War II wage controls shaping health benefits. High healthcare costs. High costs driven by advanced medical technology, specialist care, costly pharmaceuticals, and fragmented administration. Competitive insurance market. Multiple private insurers offer varied plans with different premiums and coverage, adding complexity for consumers. Innovation and disparities. The system fosters medical innovation but faces disparities in access based on income and demographics. Core components of U.S. healthcare. Public healthcare programs, Medicare, Medicaid, and CHIP. Medicare overview. Medicare provides health insurance for those 65 plus and certain disabled individuals, divided into 4 parts covering hospital, outpatient, managed care, and prescriptions. Medicaid program. Medicaid offers state and federally funded health care for low-income individuals, pregnant women, children, seniors, and people with disabilities with state-specific eligibility. Children's Health Insurance Program. CHIP extends coverage to children in families who earn too much for Medicaid but cannot afford private insurance. Impact on healthcare system. These programs collectively insure millions and shape healthcare standards through payment models, regulations, and quality initiatives nationwide. Private health insurance and employer-based coverage. Role of employer-based insurance. Employers negotiate group health plans that lower premium costs and provide comprehensive coverage for employees. Variety of insurance plan types. Private insurers offer HMOs, PPOs, EPOs, and HDHPs, each with different cost-sharing and network features. ACA Marketplace impact. The ACA created marketplaces allowing individuals to buy subsidized health plans, expanding private insurance access. Challenges of private insurance. High premiums and complex utilization management create barriers for many patients accessing care. Operational and regulatory structure. Healthcare providers and delivery networks. Variety of healthcare providers. Healthcare delivery involves hospitals, clinics, specialty centers, urgent care, long-term care, and home health organizations. Ownership and service scope. Providers vary from small rural clinics to large academic medical centers with nonprofit, for-profit, or government ownership. Integrated delivery networks and ACOS. IDNs and ACOS coordinate care across providers to improve quality and reduce healthcare costs. Telemedicine and compliance. Telemedicine transforms care delivery while providers follow regulations ensuring safety and privacy. Claims processing and reimbursement models. Claims processing steps. Claims processing involves patient registration, eligibility checks, medical coding, and electronic submission to payers. Claims adjudication. Insurers validate coverage, apply contract rules, check medical necessity, and determine patient cost sharing. Reimbursement models. Payment models include fee-for-service, value-based care, bundled payments, and capitation based on care delivery. Challenges and solutions. Claim denials from coding errors and eligibility issues require denial prevention and revenue cycle management. Governance and technology in healthcare. Regulatory bodies and compliance standards. Federal regulatory agencies, CMS, FDA, and HHS regulate healthcare programs, pharmaceuticals, and public health to ensure safety and quality. HIPAA compliance. HIPAA sets national standards for data privacy, security, and transaction processing in healthcare. Additional oversight and accreditation. CDC, ONC, state health departments, and the Joint Commission provide further oversight and accreditation for quality and safety. HealthTech standards and interoperability. Electronic health records. EHRs and EMRs store patient data securely and support clinical workflows for better care. Coordination. Health IT standards. Standards like HL7, FHIR, and ICD-10 ensure consistent data representation and interoperability across systems. Telehealth and patient portals. Telehealth enables remote consultations while patient portals provide secure access to medical records. Emerging technologies. AI, machine learning, and predictive analytics enhance clinical decision support and population health management. Trends, challenges, and future outlook. Current trends shaping U.S. healthcare. Telemedicine expansion. Virtual care options improve access for rural and underserved populations while easing facility burdens. AI and machine learning. AI enhances imaging diagnostics, risk prediction, drug discovery, and automates administrative tasks. Population health management. Focus on social determinants, chronic disease prevention, and coordinated care improves health outcomes. Value-based care transition. Shift from fee-for-service to value-based models aligns incentives to improve care quality and control costs. Challenges and future outlook of the U.S. healthcare system. Cost and outcome disparities. High healthcare costs persist despite poorer outcomes like life expectancy and infant mortality compared to peer nations. Administrative complexity. Complex billing, claims, and regulatory processes create significant waste and burden providers and payers alike. Access and workforce challenges. Geographic and socioeconomic disparities limit care access, while workforce shortages and burnout affect service delivery. Future innovations and reforms. Digital transformation, telehealth, coordinated care, and policy reforms promise a more equitable and sustainable healthcare future. Contact us for BA Healthcare Insurance Payments Domain. Training https://wa.me/9198100555734 www